And tonight, a state representative is calling for the governor to do away with a form many currently must have to even get the COVID-19 vaccine. He says that there's too much red tape standing in the way of what's needed to protect our community. Channel 9's Lauren Seabrook explains why the form is causing financial disparity between those who can get the shot and those who cannot.
Floridians most at risk of dying if they contract COVID-19 can now be vaccinated anywhere with an open appointment. But one sheet of paper is standing in the way of protection many have been waiting a year for.
There should be really just an honor system at this point on underlying medical conditions that make people vulnerable to COVID-19.
When you come through the line here, the first thing they're going to ask you to show is a form of ID. But then, if you're considered medically vulnerable, they will want to see that Florida Department of Health form filled out by your doctor. In the past, they would have taken just a doctor's note, but now they say you have to have that form.
It's just causing a lot of frustration and certainly promoting more inequity, unfortunately, in access to the vaccine.
Representative Carlos Guillermo Smith says the first problem with a form that needs a doctor's signature comes from an even bigger issue. Millions of people in Florida do not have insurance or a primary care physician.
And that's a concern. I mean, you are touching a very important point. We have reached out to the state to look for guidance on what they want, how they want to approach this issue.
But Orange County Health Officer Dr. Raul Pino believes the governor's executive order is meant for extremely vulnerable people who are already under a doctor's care.
Now that I'm taking away for a controlled diabetes or a controlled high blood pressure, but this is more complicated than that.
Smith says the state intentionally left the form vague so a doctor or hospital could decide who needs the shot. But he says that leads to even more inequities in our state because many doctors are now charging patients for an office or telemed visit before they sign off.
I think at this point, we may need to be looking at this as some sort of COVID scam of sorts.
Do you think there's something that can be done on a state level or come from the governor to prevent doctors from charging people to get this form filled out?
Yes, I believe that during a state of emergency like we're in, we should not have doctors trying to profit.
He knows doctors' offices might be strapped for resources and getting an influx of calls over this. But he says the answer should not be to charge people for a shot that's supposed to be free. In Orange County, Lauren Seabrook, Channel 9 Eyewitness News.